Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Today we are going to discuss about the causes of male infertility. What causes infertility in males and how do we examine, how do we come to the conclusion about these reasons. So there are a lot of reasons inside of male fertility, and it could be arising because of any blockage in the transportation, as in when the sperms are produced in the testis and they have to travel about 6 to 10 meters to be able to come out through the ejaculation. They pass through the testis, the vas deferens, the ejaculatory duct, then they are supplemented by seminal vesicles, the prostate. They pass through a lot of parts of the urogenital area and they come out as semen. So if there is any blockage in the entire system during the transportation, then there could be a blockage and the patient could be infertile, as if the sperms could not be produced. Or if there is a problem in the quality of sperms produced, if the count is low, if the motility is not good, if the morphology is poor, that is the shape of the sperms, if they are not according to the way they are supposed to be, then there is definitely a problem for fertilization and therefore the patient could be infertile. Then there is also the problem of hormonal defects. So any defects in the production of, for example, testosterone, any defects in the production of FSH, follicle stimulating hormone, or LH, luteinizing hormone, all these hormones also play a very important role in males also in the production of sperms. So if there is a problem there could be infertility present in the males. So let's look at what could be the reasons. So about 6% of factors could be because of sexual factors, and when I say sexual factors, I mean ejaculatory dysfunction, erectile dysfunction, or they are not able to have proper intercourse. Then it means that there is a sexual factor. So a lot of causes come under this, and the main indication is that there is no proper sexual intercourse or there is no proper erection. Then these problems need to be corrected and they come under sexual factors. Then there is the urogenital infection. If there is any infection in the entire transport machinery that I talked about, from the testis to the penis, then there is a problem of infection. Then also infertility is encountered, and about 9% of such cases are due to these reasons. About 8% are because of undescended testis. Now testis are descended into the scrotum during the time of, as in when the boy is in the mother's womb itself, they are descending, and by the time they are born they have descended. Even if they have not descended, about 6 months to 1 year also it takes in some patients when the testis descends into the scrotum. In some patients this does not descend at all and it remains in the inguinal canal. So in such cases also sperm production is affected and therefore the male patient is infertile. This has to be detected properly by the pediatrician when a child is born, or it has to be corrected by surgery eventually, or if it is not corrected then it leads to infertility because the testis remains in the urogenital area. The temperature rises and therefore testis is not able to produce sperm. So this is about 8% of the causes that we encounter. A large portion is because of varicocele. About 17% of male infertility patients face the problem of varicocele. Now this is nothing but the blood flow into the whole testis and the scrotum and all is very important, and if there is any swelling over there, then it leads to varicocele causes, because of which the temperature rises and therefore the sperm production is reduced. So this is a very important reason as well. Then there is the hypogonadism, that is hormonal reason. If there is a problem in the production of sexual hormones, if the hormones that are required to produce the sperms are not produced, then this is one of the reasons. Immune system factors, about 5% of that. If there is any immune system, any antibodies produced in the body, then the sperms are also attacked and then the sperms are not able to survive. Then we have the systemic disease. Under this comes diabetes and a lot of other lifestyle disorders which affect the production of sperm. So this is also about 34% are unexplained. Now semen analysis could be normal, everything could be fine, sexual activity could be fine, systemic disorders would be not present, varicocele may be absent, yet the patient may not be getting pregnant. This is called as unexplained infertility. If you want to understand more, if your semen-analysis report is normal or abnormal, or you are having a problem with varicocele, you want to consult about the problems that you are facing, please feel free to contact us. Thank you.